Right now, on any given weekday morning, if you stand near the border crossing at Yuma, Arizona, you will see this just really remarkable phenomenon.
Oh, absolutely.
Yeah, you'll see hundreds and sometimes even thousands of people literally just walking across the border into a tiny Mexican town called Los Algodones.
Right, yeah.
And, you know, they aren't tourists looking for souvenirs or anything, and they definitely aren't expats looking for a beach because, well, it's the desert,
Yeah, no beaches there.
right? They are walking into a town that boasts more dentists per square mile than almost anywhere else on the planet.
Which is just a wild statistic when you think about it.
It really is.
Yeah.
And they are doing this to fundamentally change how they navigate the world. I mean, they're traveling to rebuild their smiles, to restore their ability to just eat a simple apple without pain,
Yes.
and to reclaim their confidence, all without entirely bankrupting their futures. So today we are diving deep into the mechanics, the economics, and the biology of cross-border dental implants.
It is honestly one of the most fascinating shifts in modern healthcare access. And, you hit on the exact emotional center of this right away.
Well, it's an emotional thing, right?
It is, because when we talk about advanced dental restoration, specifically implants, we are rarely just talking about the mechanical function of human teeth.
Right. It's not just about chewing.
Exactly. We are talking about the deeply human desire to engage with the world without hesitation. It is about removing that subconscious microcalculation a person makes before they laugh out loud.
Oh, wow. Yeah. That hesitation.
Right. Or the anxiety they feel when they get invited to a dinner party where they don't know if they can comfortably chew the food being
I
served.
can't even imagine that kind of daily stress.
It's exhausting. So the drive to travel for this care is really rooted in the pursuit of feeling whole, empowered, and confident again.
Okay, let's unpack this because our mission for you, the listener, in today's deep dive is very specific.
Yes, very specific.
We are not here to push a decision or, act as a travel agency. We are basically acting as your analytical guide today.
Right, your research partners.
Exactly. The goal today is to equip you with the precise, high-level questions you really need to ask a provider before you ever even think about booking a flight.
Because preparation is everything.
It is. We want to move you past that basic, how much does it cost mindset and elevate your understanding so you can confidently evaluate the logistics, the technology, and the biological realities of this whole process.
Yeah, this is about turning a potentially overwhelming idea into a highly organized, completely empowering blueprint.
I love that word, blueprint. But before we get into the architecture of that blueprint, we need to do a quick tone check and disclaimer.
We do. We must establish a foundational baseline here.
Right.
Everything we discuss in this deep dive is strictly for educational purposes. We are analyzing trends, biology, and industry standards to empower you with information.
Just giving you the tools.
Exactly. However, this does not replace speaking directly with a qualified dental professional. Every single human jawbone, every medical history, every biological timeline is entirely unique.
You're not a textbook.
Right. You must always consult with a licensed dental or medical provider to understand what specific treatment protocol is appropriate for your individual physiology.
Absolutely essential context.
Yeah.
So let's start at the macro level here.
Okay.
To understand the questions we need to ask, we first have to understand the fundamental forces driving this massive migration of patients.
The big picture.
Right. We know you listening right now probably already understand the basics of what a dental implant is. But why Mexico?
That's a great question.
What is the actual economic and structural driving force that has transformed cities south of the border into these global hubs for this highly specific, incredibly technical oral surgery?
Well, the primary driver is just an undeniable economic reality regarding access to care.
Access, yeah.
Right. For a vast demographic of patients in the U.S. and Canada, comprehensive dental restoration has become structurally inaccessible.
It's just out of reach.
Completely out of reach. When a patient is looking at replacing a single tooth, or maybe they require a full arch restoration like an all-on-4 procedure, the traditional local avenues for care often present estimates that rival the cost of a luxury automobile.
Or like a down payment on a house.
Literally. It creates this barrier that leaves patients feeling as though their only option is to simply, adapt to their discomfort or their tooth loss.
But wait, I have to push back on this cost aspect right out of the gate because I think a natural skepticism arises when we talk about healthcare that is significantly less expensive?
Sure, of course it does.
The immediate assumption is usually, well, if it costs half as much, the materials must be cheaper, the technology must be outdated, right?
Right, that you get what you pay for mentality.
Exactly.
Yeah.
So how do we reconcile this much lower price point with the demand for high-quality permanent surgical outcomes?
That is the exact critical thinking we want to encourage today. And it is a misconception we need to dismantle by looking at the actual macroeconomic factors at play.
Okay, lay it out for us.
The affordability of dental care in Mexico is not achieved by utilizing inferior titanium or, outdated drills. It is a product of systemic economic differences.
So it's about the system, not the supplies.
Exactly. First, consider the cost of education. In the United States, a dental specialist often graduates with just staggering student loan debt.
Oh, I'm sure. Hundreds of thousands of dollars.
Sometimes upwards of $500,000. And that debt immediately heavily inflates the overhead cost of their practice from day one.
Right, they have to pay that back somehow.
Exactly. But in Mexico, medical and dental education is often heavily subsidized by the government.
Oh, wow. I didn't realize that.
Yeah, meaning highly skilled oral surgeons are entering the workforce without that crushing financial burden to pass on to the patient.
That makes a lot of sense. So the overhead isn't just the physical building they work in. It's the financial history of the practitioner themselves.
Precisely. Add to that the differences in the general cost of living, commercial real estate for the clinics, and the structure of malpractice insurance.
Oh, malpractice insurance in the U.S. is a massive overhead expense.
It is huge. So when you eliminate those inflated operational costs, a premier clinic in Mexico can utilize the exact same top-tier, internationally recognized implant brands.
Like the name brands.
Yes, brands like Straumann, Nobel Biocare, or Zimmer, and they utilize the exact same 3D imaging technology, but they can offer the procedure at a significantly more accessible price point.
So the patient is gaining access to advanced care simply by stepping into a different economic ecosystem.
You hit the nail on the head.
It's like realizing you've been trying to map a route to a beautiful destination, but the only highway you know has a toll booth that requires you to empty your life savings. And you pull over feeling completely defeated. But then you zoom out, you look at a broader map, and you realize there is another well-paved modern highway that gets you to the exact same destination using the same type of vehicle, but the toll is actually manageable.
I love that analogy. Broadening the map shifts the patient from a state of resignation to a state of proactive planning.
Yes, it's so empowering.
It really is. But, as with any new route, the savvy traveler doesn't just start driving blindly. They need to know how to navigate the specifics.
Right, you need directions.
Exactly. Beyond the attractive price point, what modern, highly educated dental travelers are truly looking for in Mexico is absolute transparency.
And good communication, I'd imagine.
Exceptional communication. They are looking for a clinic that acts as a partner, one that can explain complex logistical and biological processes with crystal clarity before the patient ever even leaves their living room.
Which brings us perfectly to the first stage of our blueprint. Let's say you've broadened your map, you've identified a few clinics, and you get an email with a quote.
Okay, the quote stage.
Yeah. The absolute first empowering question you must ask, and really demand a detailed answer to, is, what exactly is included in my dental implant quote?
Yes.
And I don't mean just looking at the bottom line number.
Exactly. What is fascinating here is how the structure of a quote actually reveals the integrity and communication style of the clinic.
Oh, like a test.
Kind of, yeah. A high-quality premier clinic will never, ever provide a monolithic quote that simply says, one implant, $1,500.
Because it's not just one thing.
Right. An implant procedure is a sophisticated, multi-layered biomechanical process. A proper quote should read like a highly detailed, itemized architectural blueprint.
So they need to break down the specific components.
Yes, because a dental implant is not just a single object you purchase off a shelf.
Okay, let's dive deep into that anatomy.
Yeah.
Because while, we know an implant replaces a tooth, the terminology on a medical invoice can get really dense.
It can be confusing.
Yeah, if a clinic quotes, the implant, they might literally just mean the titanium screw, right?
Often, yes.
So what are the distinct separate pieces that need to be individually accounted for on that financial blueprint?
This is where we get into the engineering of the smile. A modern dental implant is actually a highly engineered three-part system.
3 parts, got it.
First, you have the implant post. This is the biocompatible titanium or sometimes zirconia screw that is surgically integrated directly into the jawbone.
So that acts as the artificial root.
Exactly. Second, you have the abutment.
The abutment.
You can think of the abutment as the connector piece. It attaches to the top of the implant post and protrudes just slightly above the gum line.
Okay, so it connects the root to the tooth.
Yes. Its entire job is to provide a stable, perfectly angled base. And third, you have the final crown.
And that's the part people actually see.
Right. This is the custom fabricated artificial tooth that seamlessly matches your natural teeth and handles the intense mechanical stress of chewing.
Wait, so if you aren't asking for an itemized quote, you could potentially fly all the way down there, have the surgery, and then realize your quote only covered the titanium post in the bone.
It happens.
That is wild. You'd be on the hook for thousands of dollars more just to get the connector and the actual visible tooth.
And that is exactly why asking this question is an act of supreme smart planning.
Oh, for sure. It's self-advocacy.
Precisely. Clarity is the foundation of confidence here. An empowering, comprehensive quote from a reputable clinic will detail every single phase.
So it shouldn't just be the hardware.
No, it will explicitly list the cost of the initial consultation. It will include the fee for the advanced 3D CBCT imaging, which is non-negotiable for safe surgical planning, by the way.
Good to know.
And it will individually list the implant post, the abutment, and the final crown, often specifying the material of the crown as well.
What about the interim phase? Because nobody wants to walk around with a visible gap in their smile for months while they heal.
That is a critical point to bring up. The quote should explicitly state whether temporary teeth or temporary crowns are included in the price.
Because you might need those.
Oh, if you are having a front tooth extracted and an implant placed, you will absolutely need a temporary aesthetic solution during the healing phase.
Right.
Furthermore, a highly transparent quote will outline the costs of necessary clinical medications provided at the facility.
Like what?
Things like localized anesthesia, antibiotics, or anti-inflammatories, as well as the fees for any planned post-operative follow-up visits during your stay.
This transforms the experience entirely,
Yeah.
You're no longer just crossing your fingers and hoping for the best.
Right, you're in control.
By demanding this level of itemization, you just remove the guesswork. You eliminate the fear of hidden fees. When you know exactly what every single dollar is doing, you can shift all of your mental energy away from financial anxiety and focus entirely on your goal.
Which is the restoration of your smile and your health. It is the shift from being a passive consumer of healthcare to an active, informed director of your own treatment plan.
I love that.
But understanding the financial architecture is really only half the equation.
What's the other half?
The other half, and this is where we have to deeply respect human biology, is understanding the element of time.
Time.
Because despite the appeal of marketing campaigns that promise a new smile in a day, the reality of creating a permanent, structurally sound dental implant is fundamentally dictated by cellular biology.
This is such an important pivot. We need to talk about time because we live in an era of instant gratification.
We really do.
I mean, we want Amazon Prime shipping for our healthcare. The idea of walking into a clinic at 9 a.m. and walking out at 5 p.m. with a flawless, permanent, high-functioning smile is incredibly seductive.
It sounds great.
It sounds amazing, but you're saying that's not how the body actually works. So the next incredibly smart question the patient must ask the clinic is, how many visits will I actually need, and what biological processes dictate this timeline?
This is perhaps the most vital scientific concept a patient can grasp. When an oral surgeon places that titanium post into your jawbone, the surgery is merely the beginning of the process.
The very beginning.
What follows is a miraculous, slow-moving cellular event called osseointegration.
Osseointegration. Wow. Okay. It sounds incredibly complex. Break down the actual mechanism for us. Like, why is this specific metal, titanium, universally used, and what is the bone actually doing?
The history of this is actually fascinating. In the 1950s, there was a Swedish researcher named Per-Ingvar Brånemark. He was studying blood flow in the bones of rabbits.
Got rabbits.
Right. And he inserted small titanium chambers into their bone to observe the tissue. Well, when the experiment ended, he discovered, to his absolute astonishment, that the titanium had completely fused with the living bone.
Wait, really?
Yes. It couldn't be removed without breaking the bone itself. He had accidentally discovered that titanium is highly biocompatible.
So the body doesn't reject it.
Exactly. The human immune system does not recognize it as a foreign invader.
That is wild. So the body just accepts this piece of metal as part of its own architecture.
It does. When the implant is placed, specialized bone-building cells called osteoblasts immediately begin to migrate to the surface of the titanium.
Osteoblasts.
Right. And the implant itself isn't perfectly smooth. It has microscopic threads and a roughened surface texture.
To give the bone something to grab onto.
Yes. The osteoblasts literally grow new living bone tissue right into those microscopic grooves, locking the titanium post permanently into the jaw structure.
Oh.
But here is the critical factor. Bone is dense, complex tissue. It grows slowly. This process of osseointegration requires a healing period that typically spans anywhere from 3 to 6 months.
Okay, here's where it gets really interesting, and I want to use a visual analogy here for you listening. Think of this process like planting a new, beautiful tree in your backyard.
Okay, I like this.
You dig a deep hole, you place the sapling in the loose soil, and you fill it back in. Now, you wouldn't immediately take a heavy swinging tire and hang it from the branches of that little sapling on day one, right?
No, absolutely not. The sheer mechanical force would uproot the tree instantly.
Exactly. You have to give it seasons. You have to wait for the root system to branch out, to aggressively grip the surrounding earth, and to solidify its foundation against the elements.
That's right.
Your jawbone is doing the exact same thing with that titanium post. The osteoblasts are the roots gripping the earth.
Yeah.
You absolutely have to let that biological foundation solidify before you hang the tire swing.
And in this scenario, the tire swing is the immense, repetitive mechanical force of biting into a tough, crusty piece of bread or a crisp apple.
Right. You can't just start chomping on apples right away.
You can't. That analogy perfectly captures the physics of the human jaw. The biting force of an adult human can exceed 200 pounds of pressure per square inch.
200 pounds.
Yes. If you place a permanent crown on an implant and expose it to that level of chewing force before the bone has fully integrated, the micro-movements will disrupt the osteoblasts.
The roots get pulled up.
Exactly. The bone will fail to fuse, and the implant will essentially loosen and fail. This is why a highly reputable clinic will insist on a multi-visit timeline. They are prioritizing the permanent success of the procedure over the temporary convenience of speed.
Okay, so let's translate that biology into a logistical itinerary for someone traveling to Mexico. What does this multi-visit timeline practically look like for the patient planning their life around this?
For the vast majority of standard implant cases, you are looking at a minimum of 2 distinct trips.
It's trips.
Yes. Visit 1 is your surgical phase. This involves your detailed in-person evaluation, the 3D CBCT scans, any necessary preliminary work like a tooth extraction or a minor bone graft, and the actual surgical placement of the titanium implant post.
Okay, and how long are you there?
You will likely be in the destination for a few days to a week to ensure initial healing is progressing well. After that, you fly home.
And then comes the waiting game, the osseointegration phase.
Correct. For the next 3 to 6 months, you are simply living your normal life back home. You are working, spending time with family, and eating a modified diet while your jawbone quietly performs that incredible cellular fusion.
Just letting the roots grow.
Right. Once your local dentist, or the clinic in Mexico via an updated x-ray, confirms that the bone density around the implant is solid, you schedule visit 2.
And visit 2 is the finish line.
Yes. You return to the clinic, they uncover the implant, attach that specialized abutment connector we discussed earlier.
A little piece.
Yes. And then they place your beautiful, permanent, custom-engineered crown. The bite is adjusted, the aesthetics are perfected, and the restoration is complete.
See, when you explain the why behind the timeline, it stops feeling like an inconvenience and starts feeling like an empowering piece of knowledge.
It really does.
If you know you need 2 trips spread several months apart, you can take total control of your calendar. You aren't frantically trying to clear your schedule for a month straight.
No, not at all.
You can strategically plan your flights during off-peak travel seasons to optimize your budget. You can comfortably arrange time off work, sort out family logistics, and schedule your recovery periods without an ounce of stress.
You are coordinating your healthcare with total precision.
You are. You are operating from a position of profound control. And understanding that this process requires meticulous planning naturally leads us to the preparation phase.
Yeah, the prep work.
Because before you even dream of booking that first flight for visit 1, there is vital collaborative work to be done. The clinic needs to know exactly what they are dealing with before you arrive.
They do, absolutely.
Which brings us to our next critical question. And this is where the patient really steps into the role of a co-pilot in their treatment. When you are establishing communication with a clinic, the question you must ask is, what specific medical and diagnostic records should I send you before you generate my treatment plan?
This step is the ultimate separator between a clinic that is simply trying to sell a procedure and a clinic that is genuinely invested in providing elite medical care.
It's a great filter.
It is. The source materials we analyzed outline a very rigorous, specific list of diagnostics that a premier clinic will require. They will absolutely need recent, high-quality dental x-rays.
Standard x-rays. Okay.
More importantly, if you have access to them, they will want 3D cone beam computed tomography scans, commonly known as CBCT scans.
CDCC scans.
Yes. They will also request a series of clear, specific photographs of your mouth, your bite alignment, and your full smile.
But I want to push back on the 3D scans for a second.
Okay.
If someone has a standard 2D panoramic x-ray from their local dentist, the kind where the machine spins around your head.
Yeah.
Isn't that enough to see if a tooth is missing and an implant is needed?
Yeah.
Why is the 3D scan so crucial that a top clinic would demand it before planning the surgery?
That is an excellent question. Using a traditional 2D x-ray to plan complex implant surgery is akin to trying to navigate a complex mountain range using a flat piece of paper.
Oh, that makes sense.
It gives you a general outline, but it completely lacks depth. A 3D CBCT scan, however, provides a high-definition, volumetric topographical globe of your entire maxillofacial structure.
So they can see the density of the bone, not just the shape.
Exactly. The software allows the oral surgeon to digitally rotate your jawbone on their computer screen. They can measure the precise millimeter width and density of the bone available.
Wow.
Crucially, they can map out the exact pathways of vital anatomical structures. In the lower jaw, they must map the inferior alveolar nerve, which provides sensation to your lip and chin.
You definitely don't want to hit that.
No, you don't. In the upper jaw, they must measure the exact proximity of the maxillary sinus cavities.
Because if they don't know exactly where those structures are, they're flying blind, and that compromises the entire procedure.
Precisely. By analyzing the 3D scan thousands of miles before you ever cross the border, the clinic can spot logistical hurdles in advance.
Like what kind of hurdles?
Well, for example, if you've been missing a tooth for several years, the jawbone in that area naturally atrophies and thins out because it lacks the stimulation of chewing.
Oh, right. It kind of shrinks.
Yes. The clinic might analyze your scan and say, we see significant bone resorption here. We cannot safely place the implant yet. We need to plan for a bone grafting procedure first to rebuild that structural foundation.
Ah, so you know that before you go.
Exactly. This prevents the incredibly frustrating scenario of a patient traveling all the way to Mexico, only to be told they aren't a candidate for immediate surgery.
That level of proactive preparation is incredible. It ensures that when you do arrive, the surgical plan is fundamentally sound. But the records aren't just about the teeth and bones, right?
Oh, you're not.
The sources also emphasize the importance of a comprehensive medical history. Why does an oral surgeon in Mexico need to know if a patient is taking daily medication for, say, hypertension, or if they have a history of type 2 diabetes?
Because dental implantology is, at its core, a significant surgical and biological intervention. The mouth is not isolated from the rest of the body.
Right, it's all connected.
It is deeply connected to your systemic health. If a patient is taking anticoagulant medications...
Blood thinners.
Yes, blood thinners. The surgical team must know this well in advance to implement specific protocols to manage bleeding during and after the procedure. If a patient is managing diabetes, the clinic understands that this can sometimes affect microcirculation and slow down the immune response and the healing timeline we discussed earlier.
Wow. Even medications that seem totally unrelated, like certain drugs for osteoporosis, those can fundamentally alter how bone tissue heals and remodels, correct?
Absolutely. Bisphosphonates, for example, directly impact bone metabolism. A premier clinic needs this comprehensive medical dossier because it allows them to customize the entire protocol.
It's all about customization.
It is. It allows them to adjust medication dosages, alter the expected osseointegration timeline, and ensure the highest possible margin of safety and success.
It goes right back to our core theme.
Well,
Clarity empowers you.
yes.
When you provide this high-definition diagnostic and medical blueprint, the conversation you have with the clinic transcends generic estimates. It changes from, here is what we usually do, to, here is the highly customized, biologically precise plan we have designed specifically for you.
Exactly. It's tailored care.
So you have your records gathered, you understand the itemized quote, and you have a realistic grasp of the biological timeline. Now we arrive at a really exciting logistical phase.
The destination.
Yeah. Where exactly in Mexico are you taking all this meticulous preparation, and who is the individual on the other end analyzing it?
The geography of cross-border dental care is incredibly diverse, and it is largely designed to cater to different patient priorities.
What do you mean by priorities?
Well, whether that priority is maximum logistical efficiency or the desire for a tranquil recovery environment. The sources we reviewed highlight several distinct hubs: Tijuana, Mexicali, Cancun, and the rather famous Los Algodones.
Let's explore these distinct ecosystems, because they offer very different experiences.
They really do.
Tijuana and Mexicali, for instance, are the quintessential high-efficiency border hubs. If you are a patient living in Southern California, Arizona, or even flying into a major hub like San Diego, the logistical friction is incredibly low.
It's very easy to get to.
Yeah, you can fly in, take a short, dedicated transport to the border crossing, and many of these premier clinics operate their own private shuttle services that will whisk you directly from the crossing right to the clinic doors. It is a highly optimized pipeline designed for immediate, efficient access.
It is the definition of streamlined medical logistics.
Yeah.
But then you have a phenomenon like Los Algodones, which requires its own specific analysis.
Oh, Los Algodones, Molar City.
Yes. Los Algodones sits directly across the border from Yuma, Arizona. It has earned the moniker Molar City because the sheer density of dental infrastructure within a roughly 4-square-block radius is unparalleled.
It is entirely built around this specific industry.
Entirely. It is a highly walkable, deeply specialized microeconomy catering almost exclusively to North American dental and medical travelers.
So the convenience factor must be massive.
It is massive. Many patients simply drive to the border, park their car in a massive lot on the U.S. side, and walk a few hundred feet across the border directly into the waiting room of their chosen clinic.
Just walk right in.
Right. And there is an entire support system of pharmacies, optical centers, and hotels built around supporting this specific patient journey.
But then, you have the patients who want to completely reframe the surgical experience. They want to decouple the stress of medical treatment from the rush of a border crossing.
Right, they want a different vibe.
Yeah, and this is where a destination like Cancun becomes incredibly appealing.
Exactly. Cancun represents the intersection of premier medical care and high-end recovery. A patient choosing Cancun is opting for a different psychological environment entirely.
It's like a medical vacation?
Exactly. They fly into a major international airport, undergo their advanced implant procedure at a state-of-the-art facility, and then their initial recovery phase happens while looking out over the turquoise waters of the Caribbean Sea from a luxury resort.
I mean, managing mild swelling while looking at the beach sounds pretty nice.
It actively lowers cortisol levels and transforms a clinical necessity into a genuinely restorative experience.
It's all about matching the geography to your personal comfort style. But here is the critical pivot. The city provides the backdrop.
Yes.
The clinic provides the infrastructure. But at the end of the day, a beautiful beach or a convenient parking lot isn't performing your sinus lift or placing your implant. A human being is.
That is the most important factor.
Which leads us to what is arguably the most vital, yet surprisingly intimidating question a patient must ask.
Yes.
The provider.
I think a lot of people feel deeply awkward about this step. We are societally conditioned to assume that anyone wearing scrubs and a white coat possesses universal expertise.
We defer to the code, yeah. Right. We feel like we're being rude or demanding if we question a doctor's qualifications. How do we ask about an oral surgeon's specific credentials without feeling like we are cross-examining them?
This is a profound psychological barrier we must dismantle right now. You are making a significant, permanent investment in the physical architecture of your body.
A huge investment.
The most empowering question you must actively ask is, who specifically will be performing my surgical implant procedure, and what is their dedicated background?
Just ask it directly.
Yes. And you must realize that a truly elite, world-class clinic does not view this question as an insult. They view it as an opportunity. They absolutely love this question.
Because they want to brag about their talent.
Precisely. A premier clinic invests heavily in recruiting top-tier surgical talent. They want to showcase their surgeons.
So they're happy to share it.
Very happy. They want you to ask about the dentist's specific, focused experience with complex implantology. When you ask this question, a high-quality clinic coordinator will eagerly provide you with the surgeon's curriculum vitae.
So to equip our listeners with the right analytical tools, what specific details should they be looking for when they review those credentials? What separates a general dentist from an elite implantologist?
You want to look for focused continuing education. Did they complete specialized postgraduate training in implantology or periodontics?
Okay, postgraduate training.
Right. Are they members of internationally recognized organizations, such as the American Dental Association, the ADA, or the International Congress of Oral Implantologists, the ICOI?
Good to know those acronyms.
Yes. You also want to ask about their clinical volume. How many complex implant cases do they handle annually? High volume often correlates with high proficiency in handling complex or unexpected anatomical variations.
You also want to ask about the specific hardware they utilize, right? Because earlier we mentioned the big brands.
Absolutely. You want confirmation that they are utilizing globally recognized, scientifically validated implant systems, brands like Nobel Biocare or Strawman that have decades of peer-reviewed clinical research backing their long-term success rates.
Right. You don't want some off-brand hardware.
Exactly. Furthermore, you want to understand the clinical communication dynamic. Will you have the opportunity to have a virtual consultation directly with the surgeon who will be operating on you?
So you can actually talk to them before you go.
Yes, allowing you to ask specific clinical questions. Or are you only ever permitted to speak to a sales coordinator? Direct access to the clinician is a hallmark of transparent, patient-centric care.
This is such a crucial mindset shift. When you ask these specific high-level questions, you aren't being a difficult patient. You are essentially conducting a highly professional interview for the vitally important job of restoring your health.
You're hiring them.
Yes. And when a clinic answers those questions with absolute transparency, pride, and documented proof, that feeling of awkwardness entirely evaporates. You are left with profound confidence that you have selected the absolute best hands for the job.
That confidence is the bedrock of a successful medical journey.
Okay, so let's set the scene. You've curated your blueprint, you've selected the perfect location, whether you prioritize the hyper-efficiency of Molar City or the restorative calm of Cancun.
The plan is set.
Yep. You've interviewed the surgical team, and you feel incredibly confident in their expertise. Now let's talk about the physical reality of the experience itself.
Okay, getting into the chair.
Because all the planning in the world still leads to the moment where you are sitting in the surgical chair. What actually happens in that room, and how do we proactively plan for the days immediately following the procedure?
This brings us to the most universal, deeply human concern of all. It is the question every single patient harbors, even if they hesitate to articulate it.
Will it hurt?
Exactly. What will the physical sensation be like, and how will my comfort be managed?
It is the elephant in the room. We associate dental work with discomfort. So how does an empowered patient address this proactively? The smart, organizing question to ask your clinic is, what are your specific protocols for managing my comfort during the procedure, and exactly what recovery instructions will I be expected to follow before I travel home?
By asking this question well in advance, you are actively taking control of your physical experience before the first incision is ever made.
It's all about planning.
A premier clinic will be incredibly forthcoming about their anesthesiology protocols. For a standard, straightforward implant placement, robust local anesthesia is highly effective.
So just numbing the area.
Right. The area is completely numbed, and while you may feel pressure, you should feel zero acute pain. However, for more complex cases like multiple implants, bone grafting, or simply for patients who experience high levels of dental anxiety,
Which is very common.
very common, many advanced clinics offer specialized sedation dentistry.
Like twilight sedation or IV sedation.
Exactly. Intravenous sedation allows the patient to enter a state of deep, relaxed twilight. You are technically conscious and can respond to commands, but you are entirely disassociated from the procedure.
Oh, that sounds so much better.
And you typically have no memory of the surgery afterward. Knowing this option exists and discussing it beforehand removes the anticipatory anxiety that plagues so many patients.
And what about the immediate aftermath? Because once the sedation or the local anesthesia wears off, you are no longer in the clinical chair. You are back in your hotel room in Cancun or driving back across the border.
That is where the meticulous recovery roadmap becomes vital. A high-quality clinic will not simply hand you a prescription and send you on your way.
They better not.
No, they will provide a highly detailed day-by-day recovery protocol. They will explain exactly how to manage the transition to a soft food diet.
Lots of smoothies and soups, I imagine.
Yes, they will provide specific instructions on mitigating expected localized swelling using cold compresses. Crucially, they will provide a highly specific pharmacological schedule.
Meaning when to take the meds.
Exactly when to take prescribed antibiotics to prevent infection, and how to cycle specialized anti-inflammatory medications to stay ahead of any post-operative discomfort.
I think the communication aspect during recovery is massive here. If you are sitting in a hotel room at 9 p.m. on a Tuesday and you experience a sensation that feels unfamiliar, or you have a question about your medication, you don't want to be panic searching Google.
No, that's the worst thing you can do.
Right. Knowing that the clinic provides a dedicated 24/7 post-operative communication line, whether via WhatsApp, a dedicated phone number, or email, makes the recovery incredibly stress-free. You just send a message, connect with a medical professional, and receive immediate reassurance.
It creates a safety net of communication. And this detailed focus on the surgical mechanics and the physical recovery leads us to a truly fascinating psychological observation that emerged from the source material.
Oh, I know exactly what you're going to say.
Patients become so incredibly hyper-focused on the surgery. They research the titanium, they understand the bone grafts, they memorize the medication schedule.
Right. They become experts on the roots.
That they often completely overlook the most visible, tangible part of the entire process.
This was my absolute favorite realization when analyzing this topic. We get so deeply invested in the engineering of the root system that we forget to ask about the flower.
The flower, exactly.
We focus entirely on the titanium screw hidden in the bone, and we forget to scrutinize the actual artificial tooth that the entire world is going to see every time we smile.
It is a remarkably common blind spot. Patients educate themselves brilliantly on the surgical phase, but they treat the aesthetic phase, the creation of the final restoration, as an afterthought.
Just assuming it'll look fine.
Right, leaving the most critical, visible details entirely up to chance.
Which means the empowered patient must introduce another vital, highly specific question into their planning blueprint. What specific materials will be used for my final crown, and how do you ensure the aesthetic artistry of the final result?
To appreciate why this question is so powerful, we have to look closely at the science of dental materials. That final crown is the functional and aesthetic finish line.
It's the grand finale.
It is the surface that will forcefully interact with your food. It is the structure that helps shape the phonetics of your speech. And it is the physical manifestation of your restored smile.
Important.
You must ask the clinic about their laboratory partnerships and their material choices. Are they utilizing standard porcelain fused to metal, which is durable but can sometimes show a dark line at the gum?
Oh, I've seen that. Or are they using the more advanced ceramics?
Exactly. Are they utilizing monolithic zirconia? Zirconia is a remarkable, highly advanced ceramic material that is milled using CAD/CAM computer technology. It possesses immense flexural strength, making it incredibly resistant to cracking under bite pressure, yet it can be engineered to be beautifully translucent.
Let's talk about that translucency,
Yep.
because human teeth aren't just flat, stark, white blocks like piano keys.
No, they have a depth.
There is an incredible optical depth to natural enamel. If a patient is getting a single front tooth implant, that new artificial crown has to sit right next to a natural tooth and look absolutely identical. How do they achieve that?
This is where elite dentistry transitions from pure engineering into high art. It is the complex science of shade matching. A premier clinic doesn't just look at a color wheel.
They don't just hold up a paint swatch.
No. They take extensive, highly detailed digital photographs of your surrounding natural teeth under specific lighting conditions. They analyze the hue, the chroma, and the value of your natural enamel.
Wow.
They study how your natural teeth interact with light, the specific fluorescence and opalescence. They then communicate this incredibly nuanced optical data to a master ceramist in a specialized dental laboratory.
A master ceramist.
Yes, who meticulously layers the zirconia or porcelain to perfectly mimic the organic gradient and subtle imperfections of your natural smile. It should look like it grew there organically.
And it's not just the aesthetics, right? It's the mechanics of the bite, too. Even a microscopic millimeter difference in how that new crown meets your opposite teeth when you close your jaw can feel like you have a boulder in your mouth.
Absolutely. The occlusion, the way your upper and lower teeth meet, must be calibrated perfectly. You want to ask the clinic about their protocols for adjusting the bite, and crucially, what warranties or guarantees they provide on the structural integrity of the crown itself.
Because you want to know they are completely committed to perfection, both visually and functionally. Okay, so let's visualize this moment. The healing phase is over.
The osseointegration is complete.
Right. The custom, masterfully crafted crown is placed. The bite is perfectly calibrated. You hold like the mirror in the clinic, and you see a completely restored, healthy, brilliantly confident smile looking back at you.
It is a wonderful moment.
It is a profoundly emotional, triumphant moment. You've achieved the goal. You pack your bags, you board the plane, and you transition back into your everyday life. But, well, what happens then? Because biology continues. Life keeps moving.
And this brings us to the final and perhaps most sophisticated piece of smart planning in our blueprint.
Okay, the last piece.
The medical journey does not abruptly end the moment you cross the border back into the United States or Canada. Your oral health is an ongoing, lifelong biological commitment. The hardware in your mouth requires maintenance.
Which means the final empowering question you absolutely must ask, ideally before you ever begin the process, is, how is continuity of care handled, and what documentation will I receive to manage my long-term follow-up after I return home?
This question is the absolute hallmark of highly responsible, mature medical planning. A top-tier Mexican dental clinic does not view your treatment as a localized, one-off commercial transaction.
They don't just say goodbye and good luck.
Exactly. They view it as a continuum of care. Before you leave their facility for the final time, you must request and secure a comprehensive, meticulously documented dossier of every single aspect of your treatment.
You know, I like to think of this as demanding an implant passport for your new smile. You want the precise technical specifications of everything that was installed in your body.
Implant passport is the perfect term. You need physical and secure digital copies of your final records. This must include the exact, specific brand, model, and millimeter size of the implant system that was used.
Every detail.
It must include the post-treatment 3D imaging or X-rays that definitively show the final placement and bone density. It must include the exact torque specifications used to tighten the abutment screw and detailed written aftercare instructions for optimal tissue maintenance over the coming decades.
I really want to emphasize how incredibly crucial this passport is for integrating your care. You are essentially building a vital communication bridge between your specialized surgical clinic down in Mexico and your regular local dental hygienist or general dentist back home who handles your routine 6-month cleanings.
This integration is the key to longevity. Imagine a highly plausible scenario. You are at your local dentist for a routine cleaning 3 years after your procedure.
Okay.
The hygienist notices a very slight localized inflammation in the gum tissue around the implant, or perhaps the crown feels a fraction of a millimeter loose because the microscopic abutment screw needs a tiny adjustment. This is normal routine maintenance for an implant.
Right, like tightening a screw on a pair of glasses.
Exactly. But if you don't have your implant passport, your local dentist is completely flying blind. They don't know if you have a Straumann implant or a Zimmer implant. They don't know the original bone density baseline.
They might have the right tools.
They might not even possess the highly specific, proprietary microscopic torque wrench required to safely adjust that specific brand of abutment.
Oh, wow. So it's a huge problem.
It is. Without records, a routine adjustment becomes a complex investigative hurdle. But if you arrive with your highly organized implant passport, your local provider is immediately empowered.
They know exactly what to do.
They know exactly what was done, the precise biological timeline of when it was done, and the exact mechanical specifications of the hardware. They can easily source the correct proprietary tools, seamlessly communicate with the original surgical clinic in Mexico if a consultation is necessary, and manage the long-term health of the surrounding tissue with absolute precision.
It transforms a potentially stressful unknown into a routine, easily managed aspect of your overall health profile. Securing these records provides the ultimate peace of mind and ensures your investment is meticulously protected for decades.
It really is the ultimate way to close the loop on the entire cross-border process. You are operating from a position of total control from the very first email inquiry to the routine cleanings years following your final procedure.
Okay, let's take a deep breath and recap this incredible analytical journey we've been on today.
It's been a lot of information.
It has. We started by acknowledging the overwhelming barrier of local costs, and we've systematically walked through how to dismantle that barrier by taking complete, empowered control of the planning process.
The profound transformation we see in patients, moving from a state of anxious resignation to a state of confident action, relies entirely on the caliber of the questions they are willing to ask.
Exactly. So let's clearly recite the ultimate empowering checklist. This is the blueprint for you listening. First, what exactly is included in the price? Demand that itemized, highly specific financial architecture so you have total clarity. Second, what is the biological timeline? Understand the reality of osseointegration, the necessity of multiple visits, and the healing process so you can strategically plan your life without stress.
Crucial step.
Third, what diagnostic records are needed before a treatment plan is created? provide the 3D CBCT scans and the comprehensive medical history so the surgeons can customize your care safely.
Fourth, who specifically is the provider? Inquire confidently about the surgeon's focused experience, their continuing education credentials, and the globally recognized implant technology they utilize.
Yes, interview them.
Fifth, what should I expect regarding the physical recovery protocols and the aesthetic artistry of the final crown? Plan proactively for your comfort and ensure you understand the advanced materials like zirconia being used to craft your visible smile.
The flower.
Yes. And finally, how does follow-up work? Secure your comprehensive digital and physical implant passport to ensure seamless, lifelong continuity of care with your local dental professionals.
When you break it down into this logical, sequential blueprint, it feels entirely manageable, doesn't it?
It really does.
The core message here today is that asking these specific, high-level questions beforehand turns all of the murky, overwhelming confusion of medical travel into bright, clear, actionable steps. It allows you to explore your options with genuine optimism.
Positivity is key.
It ensures that traveling for dental implants isn't some blind leap of faith, but rather a highly organized, deeply confident, and proactive step toward reclaiming a healthier, more vibrant smile.
And cultivating that proactive confidence is the ultimate key. Knowing that you possess options and knowing exactly how to navigate the logistical and biological nuances of those options fundamentally alters the healthcare experience.
You are in charge.
You are no longer passively at the mercy of inaccessible local pricing structures. You have become the active, informed director of your own medical journey.
And if you are listening to this right now and you're feeling ready to start exploring these options, the source materials highlight that PlacidWay can be a tremendous, highly organized resource for this journey.
Yes, they are a great tool.
PlacidWay can help you explore verified, top-tier providers, compare your options across different dynamic Mexican destinations like Cancun or Los Algodones, and allow you to request all of this incredibly detailed information before you ever have to make a definitive decision. You can visit PlacidWay.com to learn more and request a free, comprehensive quote to start building your own personalized blueprint.
Utilizing a resource like that is an excellent, highly efficient starting point for gathering the exact logistical and financial information required to begin asking the high-level questions we've meticulously outlined today.
As we wrap up this deep dive, I want to leave you, the listener, with one final lingering idea to mull over as you go about your day. We've spent this time talking about titanium, bone biology, and the logistics of restoring teeth.
Right.
But look closely at the underlying philosophical process we've just discussed. Once you realize that high-quality, profoundly empowering healthcare can be accessed across geographical borders simply by taking charge, demanding transparency, doing the rigorous research, and having the courage to ask the right questions.
That's a powerful realization.
It is. What other areas of your life or your overall health and well-being might significantly benefit from this exact same kind of boundaryless, proactive thinking?
That is a truly wonderful, expansive perspective. The analytical skills and the self-advocacy you utilize to navigate your dental health are universally applicable tools.
It really makes you wonder what else is out there, what other solutions exist, just waiting for you to broaden your map and look. You don't have to accept the limitations you were initially presented with.
No, you don't.
You have the analytical tools, you have the blueprint of questions, and you have the power to seek out the solutions that make you feel whole. Keep exploring. Thanks for joining us today. Stay informed, stay hopeful, and keep asking those smart questions.